So I'd like to welcome everyone to the CanSim webinar. Topic today is formal training efforts to develop simulation educators in integrative review. I'd like to welcome Dr. Jane Page, professor from the Milwaukee School of Engineering in Milwaukee, Wisconsin. Professor Leslie Graham from Durham College. She's an adjunct professor at Ontario Tech University in Oshawa, Canada. And Dr. Barb Sittner, professor of nursing in the Simulation Center, Director, Bryan College of Health Science in Lincoln, Nebraska. The topic for today's webinar is of importance to the simulation community. We know how important professional development is for simulation educators, and this presentation will highlight the integrative review. So welcome, everyone.
Thank you. Well, thank you. And this is Barb Sittner, and I would like to say hello to our educators and simulationists out there in Canada. So nice to have you join us today. So as we started on this integrative review, we needed to think about what we were going to be doing. And what caused us to even begin this journey is that we were talking one day, and it's like, what is formalized training for simulation? What actually is it? And then that led us to, well, what do we need to do about this? And how do we need to formalize it? We all know that if we as facilitators are trained with simulation, we have better outcomes. However, there's a lack of evidence that supports formalized training, the methods, the curriculum for educational concepts. Our best practices to train simulation educators are unknown. And there's a call by our regulatory bodies and professional organizations that they want people that are doing simulation to have formalized training. So what is this all about? Well, first of all, the INAXL standards of best practice simulations say that we need to have formalized training and we need to be competent in what we're doing with simulation. The science of simulation has evolved such over the last decade plus that we are formalizing what we need to do, and we are trying to be consistent throughout the world. 4 of the 8 standards for the INAXL standards of best practice of simulation focus on training and competency. In the facilitation standard, we have it cited that the facilitator assumes responsibility and oversight for the entire simulation process, from the planning all the way through the debriefing and the evaluation. The facilitator needs to be competent in what they're doing. They need to utilize the INAXL standards by being proficient in the assessments and facilitating all processes that go along with simulation and linking core learning outcomes to the evaluation through assessments. And so with our formalized course work and training that is cited in the standards, we really support that there needs to be ongoing education and or working with a mentor who's been involved with simulation for a period of time. There's another standard that's a debriefing standard, and that says that facilitators need to be competent in the process of debriefing. And what that means is that we need to have some structure to the debriefing on what's going on, reflection and what went well, what areas we need to improve upon, and we need to use valid instruments. We're very fortunate that there is a lot of training out there right now for individuals on debriefing. And so that is well formalized. So we need to utilize some of those instruments that are out there to help guide us with the debriefing process, and also using some of those models that are published that are reliable and valid. We're moving to the point where participant evaluation facilitators need to be competent and trained in that also. And so simulation has gone beyond the walls of satisfaction, even though that you'll find out through our presentation that that is highly sought after, is that we want people to be satisfied with their learning experience. But there's other components to evaluating simulation that needs to be incorporated in a facilitator's role. And that is why it's so important to to have formalized training for people that do this. We also are moving to a point with our INAXL standards that it says that rater training and inter-rater reliability needs to be incorporated into part of the role of the simulation process for facilitators to benefit not only the facilitators but also to benefit our participants. We need to make sure that in evaluation that our participants are able to evaluate their scenario, but then also that we are evaluating each other. You know, did we live up to the standards that are set forth before us? How did that flow? What areas went well? What do we need to work upon? And lastly, the last standard that addresses training and competency is related to our operations standards that was published in 2017. So we want to make sure that it's an ongoing process, that we have professional development for all, that we have something in place strategically that we can review and we can evaluate what simulation experiences we have, and make sure that they are up to date with standards and evidence-based practice. We need to make sure that our personnel are up to date too, and not only the person that's facilitating, but also our technologists. And we need to make sure that everyone has training and that everything can flow as well as possible. So if we orchestrate simulation according to the standards, if we focus on our outcomes and our objectives, if we focus on the faculty development and training, if we focus on proficiency, if we know how to operate the equipment, problem solve it as best as we can when things fail, then people are going to have a great experience. So I think that's super important. And then we have some guidelines that were established in the National Council of State Boards of Nursing from the United States, that in their documents, they are saying from a study that was done, I can't remember the year exactly, it might have been 2014, where they said that we could replace clinical hours up to 50% if faculty had formalized training. Well, the guidelines came out of that research study. So they're saying that we do need dedicated trained faculty. We need dedicated individuals to work within the simulation center or the lab that we are conducting the simulation. That when we are doing our simulation scenarios, that we need to collect data about experiences and retain that data on the effectiveness of the simulation experience. And so you see that that goes back to our evaluation and all of our processes that go on with simulation. And we need to provide a means for faculty to participate in simulated related professional development, which means, you know, you that are listening to this webinar, that would be formalized training. You that are attending conferences, that are doing research, this is all professional development. And our INAXL standards are what we have right now to guide us throughout the process of formalized training. So not only does the National Council of State Boards of Nursing in the United States say this, and I'm prefacing that because that's where that study came from, is that there's other people talking about regulations for standardization of formal training. One of them being the Association of Standardized Patient Educators, and they are shortened with the term ASPE, A-S-P-E. You might hear that when you go to conferences or hear people talk. And with ASPE, they focus on, they want individuals that have training and competency in role playing for simulation scenarios. People need to be trained about what their role is. They need to be trained on how to provide feedback to participants. And in some institutions, and the majority of the institutions, I should say, that they are also, the standardized patients are involved with doing performance assessments and giving that feedback back to their participants. So individuals that are standardized patients, they need to have formalized training. The next is the National League for Nursing, and they have a vision statement, and they say through their vision statements that individuals that are doing simulation need to know the pedagogy of simulation. So how to teach. And the next is the Society for Simulation in Healthcare. All of these have different links to them. And with the Society of Simulation in Healthcare accreditation standards that they have some core standards that if you're going for accreditation of your simulation center, that you need to follow those. But they also have like another section where it is teaching and education standard. And what they want is to see evidence that people have formalized training with simulation and ongoing professional development. So as I mentioned before, the science of simulation keeps growing and we keep expanding our knowledge, and it's very important to stay current. And lastly, there's regulatory bodies. In particular, in the United States, we have the State Board of Nursing, that they're requiring formal education of those that are doing simulation at their colleges, universities. So the purpose of the integrative review that was done is to appraise formal training efforts of educators with the use of simulation-based education. The aims of this research study that is going to be presented to you were to summarize training topics that comprise formalized training, describe the structure of training programs, and explore evaluation methods of educators.
All right, thank you, Barb. This is Jane Page from Milwaukee, so I'm going to go over the next section on this. So as you listen to Barb, she was kind of justifying why we wanted to search the literature to figure out what are people doing to train simulation educators. What we found is that a lot of the research on simulation relates to learning outcomes of the participants and the students. But what we realized is that the quality of the simulation is really dependent on the skill set of the educator in running the simulation, running the debriefing. And we wanted to see what type of training programs are out there and what's published in the literature on this. Finding that or realizing that, working as a simulation educator does take a specific set of skills. It's different than, teaching classroom, different than teaching clinical. So we wanted to know, okay, what is the skill set and how do we train educators to do that? So that's kind of really our justification for this. And then you saw all the information about the standards that keep referring to what is formalized training. So one of the first things we wanted to do as we got ready to do this literature review was, okay, what is the difference between formal and informal training? And trying to find what does the literature define as those. So what we found that formal training includes, this range of activities from workshops, courses, seminars, fellowships, degree programs. Formal training involves some specific learning objectives. So that seems pretty straightforward, but what part of formal training that separates it from informal training is that there's an ongoing process to evaluate the educator who's becoming trained, and then how well have they achieved the learning objectives of the formal training that they experienced. So when we started this literature review, we came up with our method, which was going to be integrative literature review based on Whitmore and Knappel's review criteria. And that allowed us to include both research-based studies or publications, but also theoretical and evidence-based practice literature. We searched the years from 2013 to 2019. We continued our search all the way up until July of 2019. And then you can see the keywords that we used to try to capture this. We looked at teacher, educator, faculty, looking at competency, evaluation, development, and then health simulation. We didn't want to put any restrictions on healthcare disciplines, so we looked across all different disciplines and countries. We wanted to have a global view of what's published out there. We also intentionally decided to look at published literature, but excluded books. And the reason for books was sometimes they were published and then the publication process kind of would throw them outside our year range of 2013 to 2019. And we know there's a lot of literature out there that's posted on websites, on blogs, on internet professional organizations, but we focused in on the published literature. We also selected an assessment to evaluate the quality of the research study. So we used the simulation rubric that looked at simulation education rubric by Faye, who started that. So we'll go over kind of the findings from that too. And that was for the research study. The theoretical literature, we looked at whether it was meeting our aim or not. So here's a picture of our search process and following the PRISMA guidelines. So you can see the databases that we searched, open dissertations, academic premier, you can kind of read through those. We also specifically did hand searching of 3 journals: Clinical Simulation in Nursing, Simulation in Healthcare, and Advances in Simulation, and then some ancestry searching. So for all those processes, we found 2007 articles. We screened those by title and then screened them by abstract. And we had 63 articles that we read in full and then looked for our inclusion criteria. So we did exclude 25 of those based on they did not address faculty development or training, that they were more focused on evaluating the student or the learner versus talking about how you train educators. And then we excluded literature that specifically delved into a specific way to teach a debriefing approach. So we ended up with 38 articles that included our final sample. We did have a guiding framework to help structure our design process and then also to evaluate the literature. So this is the New World Kirkpatrick model. You might have heard of the Kirkpatrick levels of training evaluation. It's been around since the 50s, but in 2016, they revised this model. And this is from the Kirkpatrick. So Jim and Wendy Kirkpatrick published this in 2016. And I just want to walk you through this revised model because there were components that were added to it based on the 4 levels that were pre-existing. So really when you create a training program, you want to come up with some type of evaluation plan on how you're going to evaluate that training program you put together. And that was based on these 4 levels. You start with level 4 actually, and that's your results. So there's certain results you want to have happen as a result of whatever training you do. So that's level 4, and that's kind of, you have some desired outcomes that you want to achieve. And then how do you know you meet those outcomes are called leading indicators. And the leading indicators was one of the additions added to this 2016 version. So you may have, one overarching desired outcome, which kind of aligns with the organization's vision or mission, but there are a variety of leading indicators that can help you determine if you're meeting those outcomes. And then when we back up to level 3, this is behavior. This is on-the-job learning of how, whatever you train the educators, what are they doing back on the job? So in the case of simulation, training simulation educators, how well are they applying what they learned and how to run and conduct simulations? And that's the behavior. And while you're looking at this, there's this monitor and adjust. So you're always evaluating, what is that behavior helping to achieve those level 4 outcomes. And then part of the addition to the 2016 model is these 4 things that circle around the behavior. So monitor, reinforce, reward, and encourage. And these are called required drivers. So say an educator goes to a conference and learns a little bit about simulation, how to debrief. Okay, but then when they go back to their job in the simulation center or their academic institution or back into the practice environment, are they really applying what they learned at that conference or workshop on the job? And in order to do that, these required drivers will help the educator then apply what they learned. So you have how you reinforce that information and how do you reinforce the knowledge that they gain? And that can be in a variety of ways, which we'll talk about later. Does the educator receive some type of reward or recognition for what they're doing? And then are they encouraged to do it? Are they supported by their manager, the simulation director, to apply what they're doing? And then are they monitored? And that comes into, are we monitoring the level of skill set that simulation educators doing as they're conducting simulation? So this is really the key part of the model and the biggest piece that will probably determine the level 4 outcomes. And then we back down to level 2. This is the learning, and it looks at how do you evaluate what they learn at the formal training event, How does that affect their knowledge? And you can do pre-post tests on that. Skills, you know, are they being observed as far as are they able to demonstrate what they did? And then attitude, confidence, and commitment. And so confidence and commitment were 2 additional level 2 criteria that were added to this model. So are they committed to really doing what they learned when they're back on the job? Do they have confidence in what they're doing? And do they have the attitude to really, you know, apply? So those are usually measured shortly after the training environment. And level 1 then is reaction. And this is what's going on during the actual training. So if educators or simulation educators are attending a conference or a workshop or a course, are they fully engaged in the material? Do they feel that it's relevant to what they're doing? And are they satisfied with the training environment? Level 1 is usually measured during the training environment. So when we did our literature review, we came back and analyzed it to those different levels. So as we searched the literature, out of those 38 reports, we found 25 that were research studies and 13 that were non-research studies. And like I said, we wanted to have a global perspective. So we found the literature that came from these, I think there's 14 countries that we pulled the literature from, and then the professions that were revealed in the literature. So nursing, medicine, physician assistant, physical therapy, respiratory therapy, athletic trainer, emergency responder. And then our quality related to evaluating the 25 research studies. So we found 8 at excellent, 15 at good, and 2 at fair. So going through each of the 3 aims, kind of our findings. So the first aim was to evaluate, okay, what are the topics that are comprised in formal training programs, whether it's a course, a workshop, you know, a lot of them were longitudinal. And so we came up with the topic that we kind of grouped together and then the frequency that we saw it in the reports. Definitely you can see the top topic was coaching, debriefing, feedback. So 28 reports out of the 38 addressed that as an important topic to include in formal training. We had the next one, we had learning theories, instructional design, developing objectives, conducting a needs assessment, scenario design, developing or writing scenarios. And so those were 16, 17 reports that had that as a common topic. Evaluation of the participant or the student, how to use evaluation tools, how to evaluate the program, curricular integration, and how do you align it with learning outcomes in the curriculum. How do you create that supportive environment? And that fell under psychological safety, comportment, situational interest, human factors. Fidelity, level realism, moulage, simulation research and scholarship was in some of the more tiered type approaches. And then standards of best practice, some simulation specific theories. And I'm gonna continue on another page. Creating simulation, I repeated those. Simulation, definition, history, key characteristics, interprofessional simulation, pre-briefing. That one I saw as was a little surprised that it was kind of lower in frequency compared to what we're seeing in the literature now. So maybe it hasn't caught up with what we train educators on. How do you conduct a simulation? How do you provide cues? The different modalities, use of standardized patients, virtual simulations. Common challenges, student management, and group dynamics. So there are 5 reports that had that embedded into training programs. And as those of us who've done simulations, we know the frequency that sometimes that becomes something we have to deal with. Simulation leadership, and then logistical resources. So as you're thinking about developing training programs, these are kind of what the literature says that are common topics. The second aim was looking at the structure of formal training programs. We kind of divided that into 2 areas, the type of program and then the method to deliver the content. So the type of program, we kind of categorize those into 4 areas. So standalone courses, and that could be one course or series of courses. Workshops, which were probably more long day type workshops, and they, again, I think ranged in workshops from 1 to 4 days. Fellowships, which are more usually longer term fellowships. So fellowship may be like a year-long program. And it seemed like more medicine had more of the fellowship type of programs. And then we also found several alliances, and these alliances varied from regional, so maybe a statewide alliance like in the United States. There are also alliances that went across countries. So in Europe, there were several countries that came together and did an alliance. And then there are some national alliances. So like, for example, Australia has like a whole national alliance where they're training simulation educators over several years. And then within each of these programs, the way you deliver the content varied. And a lot of them tried and included a variety of these different ways to deliver. So there are programs that included online modules, learning communities where you can bring people together and connect them up, that they would continue to meet and discuss what they've learned in communities across time. There were some train the trainer models where you train one person who goes back and then trains more. Interactive small group learning was kind of a way to deliver content within like a workshop of a course. Self-learning, so some of these courses would require the participants or the educators to review modules or do stuff independently on their own. Mentoring, so after you've had the training, do you find a mentor who can help and guide you and develop the simulation educator? And then scaffolded delivery approaches where you have maybe levels, like maybe a novice, advanced beginner to an expert. They called them different things, but there was where you have training for this set of topics and then you move to the next level. And what we found is that not all educators need to have all the level of knowledge. So some of the expert levels were more on the leadership, doing the research, doing the scholarship type activities. All right, I'm gonna turn it over to Leslie now.
Hi, everyone. The third aim for our study was evaluation of the educator. The literature supported 4 methods primarily for evaluation of the educator. As Dr. Page was mentioning, one of them was peer feedback and mentoring. It was noted that with peer feedback as a method of evaluation, there was guiding principles that really supported that mentoring relationship. First of all, that it was really focusing on that mentoring relationship, that they had a good relationship, but also that they were of the same level of experience, etc., for that mentoring relationship to be effective, or even received as being an authentic relationship or authentic feedback. It was also important to support a culture that fostered and valued that constructive feedback. It was also recognized that within that mentoring relationship, that there was moving away from that teacher participant, teacher student, but really to neutralize that real or any kind of perceived power dynamic. So that mentoring was really a coaching and supportive relationship. As mentioned, that debriefing was the main focus for evaluation of the educator, and now we have found that while that is an important piece of it, it's really moving beyond just looking at debriefing. Although in evaluating the educator with debriefing, it was important that, as with all of the simulation scenario or conducting simulation, that the simulation educator be evaluated using well-validated and reliable evaluation tools. And some examples of that would be like the PEARLS debriefing checklist, or the DASH, the debriefing assessment for simulation in healthcare, which is a behaviorally anchored rating scale. The OSAD, which is from the UK, the Objective Structured Assessment of Debriefing. And these both of the DASH and the OSAD focused on debriefing. PEARLS focuses on debriefing as well. We found that there was another tool, the Layton et al. Tool, facilitator competency rubric, that was much more comprehensive and evaluated the entire delivery of that simulation scenario. So out of that literature review, we found that it is critical to have that evaluation method in place prior to the start of the program. So really starting with the end in mind, and as mentioned, that we start with looking at the Kirkpatrick's level 4 as you are developing your simulation program. The literature was also very consistent in reporting back that faculty are challenged by the lack of time, the limited offerings, although we are seeing more offerings that we just need to be aware of. Offerings such as this that really bring important information to the simulation or the simulation educator. Scheduling limitations. So it's not always possible to get off for a session or to take a couple of days off to go for a conference. So scheduling limitations were a real problem for some of the educators, and limited financial support. One of the things that was very clear through the literature was that academic vitality is contingent on quality and expertise of the faculty. So if you really want to be delivering high quality simulations, your faculty have to have professional development, ongoing professional development. And so, some recommendations for formalized training. Oh, limitations. My apologies. So, although we did work with a reference librarian that was very helpful in searching the literature, it's possible that some reports were missed. At times, the educator training was embedded in a manuscript, so that wasn't really the focus of the manuscript, and we would find it really deeply embedded. And so we would pull out those, but there were some that would not have been located with our search strategy. It was highly probable that there are unpublished reports from simulation training programs, certifications, regional and professional programs that are outside the inclusion criteria. And we also would like to acknowledge at this point that the presence of books and web-based resources are valuable. However, we're outside the scope of this review. So recommendations for formal training. The literature recommended that there's a few foundational topics such as creating an environment of trust and psychological safety. So all those important pieces to ensure a safe learning environment. It was also important to include simulation models and theories. And in fact, we were quite surprised that until quite recently, there was not any literature that supported the use of a simulation-specific theory or model. In more recent times, so in 2019, Barrows et al. Published used the NLN Jeffries simulation framework as part of their study. And also with debriefing, using a formal evidence-based debriefing method. Some of the other recommendations were to partner with other organizations to include an interprofessional audience. That's really the focus, really moving into that direction of interprofessional education. So really to include the interprofessional team. However, it was really key if you were doing that to have special formalized education for interprofessional education. For example, we're doing a code omega or a code transfusion, massive transfusion with the hospital with the interprofessional team, and our academic team have been brought in to provide that simulation pedagogy to the practice environment. And in the Dykman article, as with some others that we found in the literature review, there is this notion that the process of becoming a better educator, sim educator, you become a better educator. So that as you were in your journey to become, seek out professional development for simulation specific and become a better simulation educator, you became a better educator, which is no surprise. They're just very foundational educational principles, learning objectives, doing a needs assessment, learning objectives, using evidence-based debriefing methods. And so as you became a better educator, and ultimately it really translated to your personal life. So you were a better person as a result of the simulation education. Continuing with recommendations for formalized training, the literature really supported a scaffolded approach to professional development. So using a combination of didactic material, allowing that time for practice, receiving that ongoing feedback and mentoring. One of the studies that stands out, Peterson et al., really clearly laid out a program with 5 different levels of evaluation to become an expert simulation educator. So they were very well defined. And so for an example, at the expert level, they had 2 different levels, but at the highest expert level, the criteria that you would have to conduct 2 debriefing sessions that were observed by an expert, that you would conduct a minimum of 9 hours of simulation per year, that you attend and present at a national conference, and that you've identified a mentor. So really clearly laid out what their criteria would be for the simulation program. It was recognized that not everyone needed this, all the education. So not everybody needs to know everything. And so really that piece, so who do you train for what, was determined by the scope of the training based on your organizational goals. So not everybody, not all faculty needs to know simulation. Take a core group, and within that core group, determine what would best support your organizational goals. So recommendations continuing for formal training. So as the educator returns after the training program, they really need some time to develop or hone their craft, as we say, as a simulation educator. This would be facilitated by the Kirkpatrick model level 3 drivers. And so Dr. Page will elaborate on these shortly. Engaging in self-regulatory learning, a formalized self-assessment, as well as participant and peer assessment, will really provide that 360 for your own ongoing professional development. So out of this professional development plan, there should be milestones or measurable objectives or deliverables, that so as you have developed what you want to accomplish, that you will really have a formalized plan and milestones. So for instance, there is some universities that is part of progression and tenure that the faculty have to have 2 formal peer debriefing per year. And not only do they have that peer providing that debriefing, but also what is the plan for that educator based on that debriefing.
Thanks, Leslie. This is Jane back again. So once we searched the literature and we analyzed it, we wanted to come back to the New World Kirkpatrick model and just see what's published out there. How does it compare to the different levels? So when we looked at all 38 articles, we aligned them, if appropriate, to the level. So we found 1 out of the 38 articles that had a level 4 outcome. And that was a recent study published in 2019 where they had outcomes related to increasing the amount of simulation in a particular state. So this was a statewide training program. So they increased their goal was to increase the amount of simulations being used in nursing programs. And then they also tried to measure NCLEX pass rate related to the amount of simulation. And when we looked at level 3, there were 5 that looked at the level 3 where you had ability to evaluate the educator when they're back on the job. A lot of times training programs for educators are where you send an educator to someplace else, they have the training, and then they come back to where they do their job. So that's a little trickier for training programs to gather that information after the educator maybe has left the training event. And so it requires you gathering that data from them or from the simulation center that they work, where they applying what they learned with the training while they're back on the job. So there were 5 articles that looked at, evaluated at level 3, 15 at level 2. So that's a lot of times done fairly easily with a pre or post knowledge test, before the training and after the training. There are scales that look at attitude, confidence, and commitment. So we found 15 articles at that level. We also looked at, for those that reported a statistical difference, so it's interesting that those who measured knowledge, they all found a significant increase in knowledge, which kind of makes sense if you didn't know much about this at the beginning of the training, but then afterwards you redid a test and it showed a knowledge gain. There are also ones that looked at attitude and confidence. So what I thought was kind of interesting is those who looked at commitment. There was only one study that had a significant increase in commitment, where the other ones that measured for statistical significance did not see a significant increase in commitment. So what that tells me is that, how committed are educators to do what they learned when they're back on job? How can we increase their level of commitment to do that? And I think that's where the level 3 drivers really will help make the difference. And then level 1 is just looking at, are they satisfied with the training? Do they think it's relevant and they're engaged? So there were 5 that looked at level 1 occurring during the training. So what we thought would be helpful is try to give examples of those level 3 drivers. You know, when people are back on the job, how do we help develop that skill set as a simulation educator? So these are the 4 drivers. So reinforce. How do you reinforce the educator when they're back on the job to apply what they learn? So communities of practice may be an example of that. Maybe some ongoing modules or you know, learning, you know, that deliberative practice of it. Monitor is how do you get feedback? So you can do peer feedback, you can have a mentor help you. The competency tools where you evaluate the simulation educator to some pre-established threshold are ways that you monitor. Encourage, so that can be encouraged through the mentor. You can receive positive personal feedback. Administrators are a key part here. Are the administrators really supporting and encouraging the educators that they sent to training? Are they dealing with the challenges and helping them to resolve some of the challenges when they're back on the job? And then reward is how do you give those simulation educators recognition for the training that they received and for the performance. This is one that we didn't find any of the manuscripts identify a type of recognition of the simulation educators when they got back on job. And some like things that you could do is just, you know, giving some acknowledgement of it in a newsletter. Maybe there's some recognition in the simulation center that they have achieved this training. Maybe there's, you know, paying for the cost for any presentations that you're doing. So there's a lot of ways that we can provide that reward, but we didn't really find that in the literature as being reported as one of those required drivers. So going forward, we did realize that there's probably a lot of training programs out there that really have not published about their training program. And so we realized we need to probably disseminate what are people doing for simulation training. And so increasing publications about that. Maybe there's websites and blogs and other things that we need to do a review of what information is out there because we only looked at the published literature. Also, one of the articles looked at the simulation educator and did a Delphi study. And one of the things that they didn't find was any consensus on what is the minimum requirement for trainers. You know, we are coming up with standards and guidelines now, but you know, how much training does an educator need in order to be considered, you know, competent or follow the standards on that? And maybe that varies by person, but somehow we need to think about, do we need some minimum levels of requirements for that? So we did work hard on this over probably about 1.5 years, and we're pleased to announce that we did get accepted for publication in the Simulation Healthcare Journal. So hopefully once that becomes available, we can share the information on that. We did have quite a used evidence tables or matrix tables that really gives the detail on the manuscripts that we looked at that I think would be really helpful for those who are trying to design these type of training programs. So I think that ends our presentation. Now we'll kind of open it up if there's any questions. So I'll turn it back to Jane, maybe?
Yes, absolutely. So thank you very much. I've really appreciate you taking your time. And here are our presenters off to the side. So fantastic information. I had a couple of questions, and one of the is the last one you just talked about establishing some standards for minimal training for the different levels of trainers. I think it really came out that you don't have to have everyone as an expert, but having even a scaffolding within your organization. So the junior facilitators or those that are junior in simulation can really look up to those mentorship and help to expand that, especially when a lot of the facilitators in some organizations are, you know, a quick turnaround. So I think that's really needed. When you talked about your search, you talked about pre-briefing. Did you find any information on pre-simulation preparation?
So so we looked at the topics that were in training programs. And so when we looked at the manuscripts, we looked to see, okay, what are they including in their training program? We tried to, let me go back to that, see if it's embedded in. So like, I think learning objectives, doing a needs assessment, instructional design. So some of that may fall in that. We didn't have a specific topic that stand alone as far as, and when you say pre-preparation, are you thinking that what the student would do for pre-preparation?
Well, it could be both, right? So,
Yeah.
you know, you could use it as, you know, topics of formal training, like how do you select the appropriate pre-simulation preparation based on the scenario? But there's also before training programs, you know, was there any discussion on, is there any preparation that they come into the program so that they're, you know, at a certain level, especially when you talked about like one-day workshops, things like that? Did they have any information on that? It's just one of the areas of interest for myself. So,
and I think one of the top, go ahead, Leslie.
Oh, so I was just going to say that we did not find anything about pre-simulation activities, Jane. There was nothing in specific to that degree in the literature. There was about 6 articles that did talk about pre-briefing as a topic for training, but it wasn't really specific. Debriefing far outweighed the literature review. It was the most highly rated topic. Pre-briefing, there was a few, but not lots and not to that detail.
And I think it's coming to be more of a source of pre-briefing. You know, we focus so much on debriefing, which is very important, but if people don't know what to expect, and if they don't have, you know, what skills they may be evaluated on, or if they don't have the content of what the simulation experience is going to be about, if they don't have those evidence-based resources ahead of time, then there's kind of a gap there to link things throughout the simulation experience.
Yeah, absolutely.
And I think one of the things that we had ongoing conversations as researchers were, because we were looking at topics in a training program to train the simulation educator. So when we looked at the manuscript, they had these big categories. So what the detail that they actually explained and trained the educator on. So within pre-briefing, that was a category. So in the manuscript, they may not have listed out everything they taught the educator. So some of that stuff could be embedded in that training session, but may not have been obvious in the published manuscript.
And another question, was there anything on interprofessional education for training? Yes, you had it in professional.
Yeah. So I think seven publications suggested that. And that was one of our recommendations, to do more interprofessional training of educators who conduct simulation. And some of the big alliances, you know, the regional, international, you know, those were brought in all different healthcare professions, you know, typically for those. So that was definitely, I think, one of our recommendations, that, you know, because you work together and, you know, we're trying to train our students to, and our participants to work interprofessionally. It'd be great if us as educators also learn together on how to run simulations and debrief together, because some of the language is used a little bit different across disciplines. So like, it seemed like the medicine or medical publications referred to competencies of the educator, where nursing, we kind of talk about guidelines and standards. And so some of that common language probably needs to be defined a little bit more, so that we're talking similar when we're writing about it or presenting about it.
Yeah, because I think that that's one of the challenges that many of us experience, because, you know, and I'm not thinking on medicine, but they seem to have a different outcomes, different evaluations, different needs than nursing. And when we bring in nursing and physicians together in simulations, sometimes we're going in divergent areas, and it can be overwhelming for nursing. And so we want to maximize that. So I think that that's excellent. And you talked about credentialing too with these programs, like, you know, a one-day workshop compared to a one-year fellowship. I think that that's really important to have that credentialing piece, to recognize the level of expertise and have that credentialing recognized across schools of nursing or whatever profession you're in as a, as a clinical simulation expert from that. So I think that's really great. And one thing for Leslie, so you talked about the Peterson article, and they talk about, so for faculty, their own evaluation of their performance. Was there any discussion on how frequently that should be done? I know that you had talked about an article talked about the number of times that they've decided to do themselves, but is there any kind of best practices or recommendations for how often we should be evaluating ourselves or each other as a facilitator?
That's a good point, Jane. I don't recall, and I'll ask my colleagues to jump in if they recall that Peterson article, if there was any frequency denoted. It just seemed that they had everything on an annual, an annual basis. So they had so many things that had to be accomplished on an annual basis or per year. So to me, it was all done on an annual basis.
Right. And I think from all the faculty development that I've been involved in, one of the best ways, or one of the most important pieces of evaluation is to put myself in the role of the student. So now, someone else is, evaluating me, and it really puts things into perspective and helps me as a facilitator, making sure that I'm, providing a safe environment, how to give constructive feedback when you're having someone else give it to you, or you're even in the hot spot, how to keep you calm. So I think that this is fantastic and so needed. So I'd like to thank everyone for coming in, and we will be posting it on the CanSim website. So thank you so much.
Thank you.
You're very welcome. Bye now.
Bye.